Greetings to the viewers of this video. In this video, we are going to see what nasal decongestants is and look upon a specific drug called oxymetazoline. Nasal decongestants are alpha receptor agonists. The nasal mucosa is primarily composed of alpha receptors. The topical application of nasal decongestant results in vasoconstriction. They are available as dilute solution of concentration ranging from 0.05 to 1%. They have longer duration of action, which is 12 hours. Regular and long-term usage may damage the mucosal ciliary function. Persistent vasoconstriction can cause anosmia, that is loss of smell sensation, and atrophic rhinitis, which is inflammation of nasal mucosa. Nasal decongestants must be carefully used in hypertensive patient and those who receive monoamine oxidase inhibitors. Moreover, nasal decongestants can lead to central nervous system depression and rise in blood pressure systemically. Let us see about the drug oxymetazoline. Oxymetazoline is a potent, direct-acting alpha-adrenergic agonist, and it is an imidazole derivative. This is the structure of oxymetazoline. It is used to treat nasal congestion caused by common cold, hay fever, and upper respiratory allergies. Now, look at this box. This is Nasivion nasal drops. Its main component is oxymetazoline hydrochloride nasal solution IP. In the concentration of 0.05%. It provides fast relief from blocked nose. In addition, it is an adult dose. The total amount of content in this nasal solution is 10 milliliters. Now, let us see the composition of the nasal drops, its dosage and the storage conditions. Each 1 milliliter of Nasivion nasal drop consists of oxymetazoline hydrochloride as per Indian pharmacopoeia. That is 0.5 mg dissolved in buffered aqueous solution. The preservative used in this nasal drop is 50% benzalkonium chloride, IP, which is 0.3 mg. Now, let us see the dosage. Instill 1 to 2 drops of Nasivion 0.05% solution into each nostril, 2 to 3 times a day. Then, one of the most important thing is that you should not use this solution more than 10 consecutive days. Moreover, this medicine is not for babies and children under 6 years of age. Store this in a tight container, at a temperature not exceeding 30 degrees Celsius. It is for external use only. In addition, do not use if the seal is broken, and keep out of reach of children. Let us look upon other information. This nasal drop starts working within 25 seconds of administration, that is, the decongestion is achieved. After 25 seconds of administration, be used if you have 2 days of shortening cold. Also, this drop has an antiviral effect. Oxymetazoline HCl has active substance, which opens up blocked nose resulting from common cold, dust and pollution or seasonal changes. It is better to use this drops 2 times a day, morning and at bedtime. The batch number, manufacturing and expiry date, along with this the maximum retail price is also indicated. Let us open up this box and look at the contents inside the box. Opening it up, it has a filler for convenient administration of nasal drops into the nostrils. Along with the filler, there is a container for holding up the drug oxymetazoline, 0.05%, in solution form. It can be used if you have 2 days of shortening cold. Also, this drop has an antiviral effect. Oxymetazoline HCl has active substance, which opens up blocked nose resulting from common cold, dust and pollution or seasonal changes. It is better to use this drops 2 times a day, morning and at bedtime. The batch number, manufacturing and expiry date along with this the maximum retail price is also indicated. Let us open up this box, and look at the contents inside the box. Opening it up, it has a filler for convenient administration of nasal drops into the nostrils. Along with the filler, there is a container for holding up the drug oxymetazoline, 0.05%, in solution form. Let us see the mechanism of action. Oxymetazoline binds to the alpha-1 and alpha-2 adrenoreceptors, which are G-protein-coupled receptors that promote smooth muscle contraction, by increasing the calcium levels. Because of muscle contraction, vasoconstriction occurs. Now, let us see the steps in administration of nasal drops systematically. 1. Gently blow, and clear the contents of the nose, such as mucus, and other matters. 2. Lie down, and tilt the head lower than shoulder, with the help of a pillow. 3. Instill 1 to 2 drops per nostril. 4. After instilling the drops, bring the head forward and gently turn from side to side, to ensure proper distribution of solution. Oxymetazoline is also used in topical formulation of drug used to treat persistent facial redness associated with rosacea. In density, oxymetazoline and local anesthetic tetracaine is used to provide regional anesthesia during dental procedures. Thanks for watching. Have a great day.